Horny cons, horny warts will include. What will the thumb, what will the palmar surface of the hand? Remember there are only two remedies in the Metromedia, anacardium and apneo. What will the palmar surface of the hand, palm of the hand, anacardium and apneo. And with very poor memory. She didn't have the absent-mindedness but very poor memory. Again, one of the slum clinic cases where anacardium completely eradicated. Within the fourth visit, it was completely gone. So, very many times, so look of the skin or area of the skin is very important to understand and analyze for anacardium in such cases. Another remedy which I'd like to share with you before we take a break is organ which has a combination of, you see, sulfur, graphitis, sorinum, tuberculin, petroleum. Remember the key word for organ is congestion. Organ pure or organ bark. The key word is congestion. So that's a very important factor for organ. And remember in combination with these remedies, redness is important. It could be active redness of tuberculin, it could be like a pale redness which you have sometimes find with sulfur as well. But organ is very important. Cases of I want you to understand this medicine as I prescribed it with very good results in many cases. My friends, when you come across cases of acne which are suppurating, cases of and you have tried all your regular suppurative medicines, you have tried Pepper, you have tried mercury, you have tried silica, give a try to cephalococcine. My friend, cephalococcine is a remedy for recurrent abscesses or skin conditions with suppuration. Cephalococcine you can find it, and you can find a lot of detailed information about cephalococcine, where we use it a lot acne with pus across the country which are suppurating. You have tried your suppurative medicines, it's not working. Remember, cephalococcine is a nozole. And when you are prescribing a nozole, you are breaking that cycle of recurrence. So cephalococcine will help you break that cycle of recurrence. So cases of acne with pus, cases of abscesses, and any pyogenic condition where cephalococcine can come in handy. How you differentiate this with pyrogen? Remember, pyrogen also has recurrent abscesses. If you look at the name implies it, pyrexia, fever is always there with pyrogen. Cephalococcine may not have any fever at all. So recurrent fistulas, if you have had failures with your constitutional remedies, you will try to cephalococcine because it breaks the cycle of recurrence. It's an out and out symptomatic remedy and will help to break that cycle of recurrence with cephalococcine. So acne with pus, fistula nano with pus, recurrent boils with pus, any character of pus. The character of pus is immaterial, have failed. And that's a very useful indication. Remember the difference with pyrogen, no fever is cephalococcine. Many times you can find recurrent staphylococcal infection, but even if that's not there, you see the combination when Marsol has failed, when silica has failed. So all your suppurative medicines you have tried, that's not working. Think of cephalococcine. Succession of boils, succession of abscesses, succession of pyogenic inflammation. 200C is always the starting potency. It's a nozole, 200C onwards for cephalococcine. Fistula nano, I want you to try cephalococcine if you have had failures. What I learned as a clinical tip for fistula cases, my granddad taught me, hot patient with fistula nano which is recurrent by fluoric acid. Hot syphilitic with fistula nano which is try cephalococcine. hot symphytic with pus, fluoric acid, no thermalization, recurrent pus. Again, obviously, this is not to start the case. When you have had failures with your starting remedies, try cephalosporin in practice. So I'm sure you will have benefits with cephalosporin in such cases. 200 C, even 1M10, and go up to the higher potencies, and it completely eradicates the tendency to recurrent pus. So that's important about your cephalosporin. I want to share with you this remedy as well, as we are sharing with the skin cases. Again, a remedy which perhaps may not have used so frequently in practice, but I've used it very well with good cases. Hear me for this remedy, please. You know, streptococcus is the causative organism. In rheumatic fever, which organs are affected? Joints, throat, heart. Right? You know, it licks the joint, bites the heart. Keeping that sphere of action in mind, if you make a triangle, joints, heart, throat. Forget about rheumatic fever. Forget about streptococcus. But that sphere of action, joints, heart, throat. In cases, my friends, when these three are the weak organs, a patient who is in his 30s, 40s, afflicted with rheumatoid arthritis, he's telling you, my joints are red, joints are hot, joints are swollen, skin around their joint has turned red. You with me? Joints are red, hot, swollen, skin around the joints has turned red. He's telling me now my pain is bad. First, radial bromide today, you know Rostov. Streptococcus is the third one in that list. Aggravation, first motion, wherever I continue motion. But what is there in streptococcus, not in Rostov? Joints are red, joints are hot, joints are swollen. This is what you call as inflammatory rheumatism. Right? So aggravation, first motion, wherever I continue motion. In a patient whose joints are red, hot and swollen. That's the one side of the triangle. He's telling you now in his 30s, the past. Or I had a tonsillectomy. So tonsils are the weak link, or where the weak link. Tonsils got it removed, or had a recurrent tonsillitis in the past. Second side, throat is affected. Third side, no cardiac condition, but I get frequent episodes of palpitation. Frequent episodes of angina or palpitation. Heart is the weak link. Heart, throat, when you give a try to streptococcus. If you see here, clinical therapy, rheumatic heart disease, you may not have it. Case of recurrent tonsillitis. Remember, my friends, streptococcus is also a fantastic medicine for never give since vaccination. So many people in today's world, you find post-COVID vaccination, they will tell you my joint symptoms have started. Your strep is a fantastic medicine to help such cases. Try it work, because it will work. Cases of bad effects of vaccination resulting in musculoskeletal involvement. You understand what I mean? Bad effect, got the COVID vaccine, few months later back pain started, few months later ankylosing spondylitis started, few months later rheumatic arthritis started. What is the effects of vaccination? Your streptococcus has a wonderful action for that. You know, very practical medicine, very underused. If you see here the modality, Rostrov's like rheumatic symptoms. When Rostrov's fails, aggravation first motion, better by continued motion, like Rostrov's. You see weight with an aggravation, like Rostrov's. But what is the difference? The pathology is the difference. Rostrov's has more stiffness, soreness, it's more muscles are affected Rostrov's. But here, joints are red for streptococcus. So that's a weak link. And you see the sphere of action, palpitation, no heart pathology, forget about heart pathology. I'm just getting episodes of palpitation. That's a good enough symptom. It has an action on the heart. Recurrent tonsillitis or a past history of tonsillectomy. So my first indication for streptococcus, my friends, is this triad: joints, heart, throat. Joints, but inflammatory rheumatism has as an additional factor. That's why I shared with the skin as a whole, because that area of the skin has a superficial erythema that gets red because of the inflammation. You can start to itch even that part. You come across in today's day and age of autoimmune rheumatic disorders, where again streptococcus can come handy. So joint is the weakening. Throat, convulsions, tonsillectomy. Third area, palpitation. Post 2021, you'll find lots of cases. I got a COVID vaccine. After that, my arthritis is done. I had arthritis in the past. I got it cured with homeopathy. It has come back again after the vaccination. Try streptococcus. Never been well since vaccination is a very important factor for streptococcus. So that's the number one aspect. So what is the skin aspect here? Itching, superficial erythema. So that's one. Where you have 103 fever. The mother is calling you up and telling you, my child has 103 fever. Tonsils are really red. There is no pus, there is no white spots, but it's red tonsils. 103 Fahrenheit, it came suddenly. You're giving Belladonna, you're giving Aconite. It has helped, but again 6 hours later, she's calling you again, the fever is back. You tried Belladonna 200, tried 180. And you're getting Belladonna working. Should you go for paracetamol? With tonsillitis. But remember, it's a congestive tonsillitis, redness, no pus. That's the difference between all other suppurative medicines. So cases of high fever with tonsillitis, when your Belladonna or Aconite has failed, preferably Belladonna, and the treatment, try streptococcus, even in an acute state. And you know what is the beauty of this medicine? Patients have come back and told me, the child didn't have any episode of strep tonsillitis after that. Because A, it has an acute action, although it's a nozole. It has an acute action. It can take care of the acute episode, bring down the fever, bring down the tonsillar inflammation. But B, as it's a nozole, it can prevent further recurrence. So even one dose of streptococcus in the acute state, and they will tell you, I haven't had any streptococcus, haven't had any tonsillitis, even in the future as well. Fever with tonsillitis, where you have tried Belladonna, it hasn't helped, try streptococcus. Put in your notes, when Belladonna fails for congestive tonsillitis, or try streptococcus. That's why you see here anti-febrile action, high fever with the congestive tonsillitis. It works wonderfully for such a case. So that's the second use of streptococcus. In an acute, also it prevents further recurrence. Or the patient has come to you, my child gets frequent episodes of fever, and with the fever, every time there is a tonsillitis. You have given Belladonna, you have given. So, I'm spending so much time with streptococcus because I want you to try it in your practice. Third use of streptococcus, another brilliant use. Cases of acute blood dysentery, bacillary dysentery, where there is a lot of blood with the stool. Mercurius, Allen's, more the blood, better it is indicated, right? That's the line in Allen's for Mercurius. More the blood, better it is indicated. But in Mercurius, bleeding is with tenesmus. A lot of cramps, abdominal cramps, anal spasm. Lot of blood with the stool. Remember, streptococcus is a hemorrhagic medicine. Lot of blood with the stool. But there is no cramps, minus the cramps of Mercurius, think of streptococcus. So more the blood, better it is indicated. So Mercurius followed by streptococcus is a very good chain for cases of bacillary dysentery or blood dysentery. And that is also a very important factor for streptococcus. You see stools with blood, pyresia, and fever can be an associated factor. No tenesmus, but blood. The fourth and last, I will say, very useful, my friends, for cases of never been well since tonsillectomy. You find cases, I'm sure, those who are dealing with pediatric cases, children who have gone free, who have done adenoidectomy or tonsillectomy, they twitches, chorea, and start. Streptococcus is a very useful medicine to start such cases, where you have twitching chorea which is started post tonsillectomy. And streptococcus can also handle such cases with brilliant results. So A, recurrent tonsillitis, you can prescribe to prevent the recurrence. B, for acute tonsillitis, no congestion, no streptococcus can help. And thirdly, for never been well since tonsillectomy as well. So two never been well since, one is tonsillectomy and the other is vaccination. You see streptococcus has rheumatic symptoms like rust. Worst in wet weather, worst first motion, continued motion. But add their inflammatory rheumatism. Joints are red, bad effects of vaccination. No tenesmus like mercury. And you see again tonsillitis followed by chorea, followed by tics. Streptococcus can come in handy as well. So joints, heart, throat, these are the three weak links in chronic. Remember it for acute tonsillitis, remember it for acute blood dysentery. It's a very underrated medicine, my friends. One clinical tip which I'd like you to please remember this for your cases if you are doing cases of osteoarthritis. Aggravation first motion better by continued motion is a very common modality which arthritis patients will tell. And his father told him there are 10 medicines which works wonderfully for that. I remember it in my head because I use it in my practice and I want you to try it as well. Aggravation first motion better by continued motion is a very common modality for osteoarthritis. I want you to note that. We have talked three already: Rhus, radium, streptococci, anacardium, conium, capsicum, parametallicum, calcaria flumica, lycopodium. Remember these 10. Calcaria flu, Rhus, radium bromide, streptococci, pulsatilla, lycopodium, and streptococci. For aggravation, first motion, better by continued motion, they really help in the clinical practice as well. So that's about your streptococci 30C in joints involvement, but for tonsillitis we use a 200C. It's short for lunch. Again, I'm taking you back to 1930s and 40s of that. This was one of the stories which you had told me of some eminent homeopath in Calcutta. He was treating a woman, female prescriber, but he got this case of a person who came to him with tremors. So although this homeopath was not an average prescriber other than gynecological conditions, but and it could return him back. But he used to do proofreading in the printing job, and he somehow got interested in Metromedica and he started to read Metromedica. So he became Metromedica prescriber by law. So he's treating this patient for tremors, and he had been to other homeopaths, but they hadn't given any good changes. Some had prescribed gelsemium, some had prescribed opium for different conditions, but he was not being, there was no change. Interesting backdrop to it. The coal mine, Jharkhand is a state which is very mine. There was a collapse and he got trapped with a few other of his friends. And in the coal mine, still they do now, they used to wear a hat with a small lamp on the head. And he was trapped there for almost 3 days. By the end of the first day, the died. Somehow or the other, he was rescued in 3 days' time. And within a month or 1.5 months, the tremor started. So you see, he had been to different homeopaths and they had prescribed opium, gelsemium, understand based on fear and fright, being trapped in the coal mine and tremors. But I learned this again, story, that always ask the big. And what he said interestingly was that I was trapped in the coal mine for 3 days, 72 hours. And those 72 hours felt like 72 years of my life. It's like there's no light in my life and I'm going to die. Right? So those 72 hours were like 72 years of my life. What is the manifestation? If you have your Allen's keynotes, if you read Argentum Nitricum, first paragraph, acute or chronic diseases, 72 hours when you are strapped to the coal mine. Those are unusual, those are long continued for him. And what is the manifestation? Acute or chronic diseases from unusual or long continued mental exertion. So that few hours were like few years for him. And what is the manifestation? Argentum Nitricum was prescribed and he got better within 6 to 8 months' time. So again, what I learned from that case was always look for the patient's own imitation of that situation rather than what you fear and try to mental exertion. And that is the case. Thank you very much for your time and attention.
We'll have a question answer session after second session. So keep your questions ready after the second session. Now it's 12:43. All in half an hour and we'll start. So have your lunch quickly and come. No chit chats and selfies. You come back as early as possible. We'll start exactly at 1:15. Thank you.
Thank you.